Today, I will make a talk about the title of Current State of Integrative Oncology in Korea. Is my content. Firstly, I will make a talk about overall landscape of integrative oncology in Korea. This paper presented a clear growth and development of urban medicine and cancer research in Korea. It is published in 2011. Now that another 12 years have passed since then, it would be very nice to review the last 12 years of development in integrative oncology researchers in Korea. It's the paper for the behavior and attitude toward the use of complementary and alternative medicine among Korean cancer patients. The median age was 60 years old and 60% were male. And just belief in CAM, duration of disease were independent factors for using CAM in multivariable analysis. And just belief in CAM was significantly associated with the current use of CAM, and only 25% of patients discussed CAM with their physicians. Is the survey for the predictors of complementary and alternative medicine used in cancer care, result of a nationwide multi-center survey in Korea. And 2661 cancer patients were surveyed on factors that could predict the use of complementary and alternative medicine therapy. And the results showed that 25.5% of the participants have used or experienced the CAM therapies. And higher income, cancer metastasis stages and diagnosis period, lower trust and satisfaction in conventional hospitals and doctors, higher needs of medical information affected the decision usage of complementary and alternative medicine in Korea. It's the result from our East-West Cancer Center. The integrated cancer treatment may have a survival benefit in patients with lung cancer. It's a retrospective cohort study from our East-West Cancer Center. This result suggests that integration of traditional Korean medicine and conventional cancer treatment may have survival benefits in patients with lung cancer. And even though this study had a limitation, including heterogeneity between treatment group, the study results suggest that integrated cancer treatment has positive effect on survival probability. It's the result from the prospective cohort study, the effect of traditional Korean medicine, oncotherapy on the survival, quality of life, and the telomere length. And this is study of the relationship between telomere length and the prognostic factor discovered that patients with advanced end stage at the time of diagnosis and who had previously received the radiotherapy had shorter telomere length. And when examining association between SMP genotype and the percentile score of telomere length, this study was showed to confirm the association between telomere length and telomere length. In Korea, National Cancer Center made a pilot project to support integrative cancer survivors. In Korea, 5 years relative survival rate reaches 71.5%. And 2.27 million cancer patients in Korea, accounting for 4.4% of all Koreans in 2020. Therefore, growing demand on resolving various difficulties experienced by cancer patients and survivors. Accordingly, National Cancer Center and the 12 regional integrated cancer centers are striving to provide integrated support for cancer patients and the survivors from 2019. This program guideline was developed for cancer patients who have completed conventional treatment by National Cancer Center. The program is for a complete recovery after diagnosis of cancer and their families. And experts in various fields, including doctors, nurses, and the social worker, will work together with the survivors, helping the survivors return to normal lives. It's the list of 12 integrative cancer centers participating in this project, even distributed throughout all world of Korea. There are 3 integrative oncology hospitals in Korea from investigated from Ministry of Health and Welfare. Chang Integrated Medicine Hospital, Wongang Hospital opened from 2017, and Daegu Integrated Medicine Promotion Agency, Cheonin Hospital, was opened from 2015, and Chungju Widam Comprehensive Integrated Medicine Hospital opened from 2021. And this the government designated integrative medical hospital include the integrative oncology therapy such as high frequency thermal cancer treatment, immunotherapy, etc. And 24 hospitals that are affiliated with 13 Korean 12 medical Korean Medicine University in Korea existed. TKM takes up large part of integrative oncology in Korea, so traditional Korean medicine hospitals are actively participating in providing integrative oncology treatment by using traditional Korean medicine. This study was motivated by a joint guideline released in 2022 by the Society of Integrative Oncology, SIO, and the American Society of Clinical Oncology, ASCO. According to this guideline, acupuncture was recommended for treating cancer-related pain with intermediate quality of evidence and moderate strength of recommendation. And it's the study for the integrative medicine for pain, needs, belief, and experiences of patients with cancer survey research. The director is Dr. Jun Mao from Memorial Sloan Kettering Cancer Center in New York. And the study period is from the October to end of this year. The participating countries are South Korea, China, Nigeria, India. And through this study, we anticipate gaining insight into the global perception and the needs for cancer patients regarding integrative medicine, which will inform better pain management strategies and policies. Next, we'll move to the organization, healthcare coverage, and the challenge of integrative oncology in Korea. These are the leading integrative oncology hospital affiliated to university in Korea. Korean Medical Cancer Center of Gyeonggi University and the East-West Cancer Center of Daejeon University. These both groups have their unique integrative oncology program independently. This study looked at the clinical effect and the overall survival rate of patients with advanced MSCLC patients who have undergone pure balance cancer therapy, the unique integrative oncology program of East-West Cancer Center. And the result showed that when advanced MSCLC patients receive WBCT, our integrative oncology program, it can significantly prolong the survival time. And this study investigated the correlation of a level of non-specific inflammatory markers, CRP and ESR, and the coagulation marker, fibrinogen, with the treatment period of our integrative oncology program. And more patients with stable or decreased CRP and ESR were found in the more than 21 days integrative oncology program group than a shorter period group. It's the integrative healing program of Kyung University in Korean Medicine Hospital. It consists of herbal medicine, acupuncture, qigong, mox busuchan, tai chi, resonant therapy, thermal therapy, and meditation. This randomized controlled trial study looked at the efficacy and safety of the traditional herbal formula, kamikibitang, in cancer patients, and the result showed that sleeping disturbance improved significantly more in the kamikibitang group than in the waitlist group. And this study estimated the efficacy and the safety of the yukunjatang and to establish evidence for the use of herbal medicine in the management of patients with cancer-related anorexia. And the difference in the primary outcome between the control and the treatment group was statistically significant. And this result confirmed that efficacy and the safety of using yukunjatang as an herbal medicine treatment option for patients with cancer-related anorexia. To summarize, integrative oncology in Korea is currently practiced in governmental designated and private cancer centers and the Korean Medicine Hospital clinics. And TKM in Korea is a large part of integrative oncology treatment and researches. And to be more successful, effort to prove the safety and efficacy of these modalities should be continued. And the well-established randomized controlled trial researches to be able to reach systemic consideration and build clinical guidelines should be conducted. Let's talk about the KSIO, Korean Society for Integrative Oncology. KSIO was founded in 2015, and KSIO aims to develop and disseminate integrative oncology in Korea. And academic conferences has been held every year since 2015 and started a board certificated education program in 2018. And KSIO presents recent evidence-based clinical outcome, provides academic lectures to be both professionals and to the publics, and already has translated and published 2 books so far. The title is Integrative Oncology and Anti-Cancer Living. In Korea, since Korea has a dual medical system of Korean traditional medicine and conventional medicine, and with this fairly new field of integrative oncology, health coverage and reimbursement has not fully developed yet. But with more research and proof, we hope more and more integrative oncology therapy will be covered by the insurance, offering convenience to the patient. Now, some challenges we are facing. The discrepancy between the demand from the patient and official advice and the referral from medical doctors. Since patient recovery and health should be to the top priority, effort should be made to reduce the knowledge gap and to have evidence-based information for the patient. Second, lack of information on pros and cons of integrative oncology therapy. To overcome this issue, more well-established research and clinical trial are needed to build efficacy and the safety of integrative oncology therapy. And critical pathway or clinical practice guideline that effectively combines conventional medical system and integrative oncology therapy should be developed, so we have standard traditional Korean medical treatment guideline. Now, move to the integrative oncology clinical practice guideline development in Korea. CPG for Korean Medical Center cancer treatment is actively being developed in Korea. The National Institute of the Korean Medicine Develop, NICOM, is in charge of developing guidelines for Korean medicine, hospital, and clinics. And nowadays, we have a cancer-related symptom CPG, which include fatigue, pain, loss of appetite, nausea, peripheral neuropathy, insomnia, dry mouth, bowel obstruction, and post-operative pain. And breast cancer CPG has been developed as well and include pain, depression, and anxiety, flushing, nausea and vomiting, and quality of life. And based on this CPG, additional work is currently being done on CPX, educational videos, and terminology organization. And clinical guideline for our medicine treatment of gastric cancer is already developed using Delphi technique and the systematic review. And lung cancer, CP, critical pathway, was created and is attempting to optimize the Korean medicine and the conventional medicine treatment process as a two-way cooperative critical pathway with a relatively consistent and standardized patient-centered treatment management plan. Thank you for your time.